And welcome to the Monday, October 19th, 2020 at 1 p.m. Health and Human Services Committee meeting. I'd like to welcome everyone and thank you for attending. Let's start off with calling this meeting to order. Are there any changes to our agenda this afternoon? No. Okay, I see all of our committee members here. And Kathy, have we received anyone that would like to speak on a privilege of the floor for public comment?
No, Shauna, we have not.
Okay, thank you very much. I do not see anyone in the chambers as well. Is there anyone that's here that would like to speak on privilege of the floor? Hi, Karen, it's nice to see you. Welcome to HHS Today. Oh, I think you're muted.
Hi, and Mike Ellis is also here with me.
Okay, great. Nice to have you.
Very nice being here.
Great. And I see that our Chief Equity and Diversity Officer, Deanna Carruthers, is here joining us today. Welcome to Health and Human Services Committee. We're happy to have you.
Thank you.
Great. And let's see here. I have a pretty short chairs report again this month. We are in the middle of budget season, and so that's been taking quite a bit of our time and effort. And I know that our department heads that are here will be very happy when it's over. And I know that the legislators and Jason will all be very happy when this is over. I feel like we're in the final stretch and there's light at the end of the tunnel, hopefully. We still don't have money to do all the great things that we want to do, but hopefully we'll have a better year next year, and we'll figure out how to move forward with COVID. And I think we just have to stay hopeful. I also wanted to let everyone know that there will be, like we have had in the past in our legislature meetings, we will have another COVID-19 update by Frank tomorrow at our legislature meeting. And so you can ask questions this afternoon whenever Frank gives his report, or you can save the questions for tomorrow. I know that our committee has had concerns about our public health nurses working long hours, working many days in a row, and we can certainly get an update from Frank this afternoon on that. But we are doing some things in our budget to help with that. We have an OTR that hopefully will pass, that will allow us to hire a full-time traveling nurse starting in January and going through July. That nurse would work Thursday to Monday to help relieve some of the pressure that we're seeing with our public health nurses. Some of the other OTRs that I think are hitting the public health would be reinstating to a full-time status, I believe 4 of our employees in public health. And then also, let's see here, the other one was for a technician that we need to go ahead and hire that will relieve some of the stress. So why don't we move on to the county administrator's report? Jason?
Hi, Shauna. I'm going to yield my time to Deanna to give the group an update. I know she's meeting with all of the committees. She's doing a guest appearance for all the committees this month. So I'll turn it over to Deanna and let her give a little bit of an update on some of the things she's working on.
Thank you, Jason, and thank you all for the warm welcome. So if you've heard this before, if you're in another committee, I'll try to add some more flair to it this afternoon. First and foremost, I am excited to be a part of the Tompkins County team. We have hit the ground running. I've met with over 40 different individuals, including all of the department heads, except for a couple of folks, and then community members as well. I will be meeting with the Executive Exchange group. I've reviewed their particular charter and their statement related to anti-racism. I'll also be meeting with some economic development folks looking at their proposals and plans. But specifically, I was brought here to do an internal assessment so that we can ensure that our services are reflective of the community we serve. So thinking about it from inside out. And so what does that mean? That means the diversity belongs to all of us. And by the time that I die or leave or fight trying, we're going to all be saying that together. So you're going to hear me say that every single time you hear me say something. So with that, what does that mean? I had a great meeting this morning with Arel and I believe Alan from facilities in terms of some of the work there and looking at the demographics and some of the powerful work that they do. I made sure to thank them for their service. Specifically, a lot of the reason why we don't probably see more outbreaks and things of that nature is because of the work that they do, ensuring that we have all the things that we need, ensuring that all the employees in that the place is up to par and that it lives up to the standard that we hold for ourselves. What does that look like moving forward, specifically in terms of operationalizing the work? Working with the JDI team, over 38 committed folks, and I'd like to thank Amy Hendricks. I'd like to thank Jason Molino. I'd like to thank Lisa Holmes for the strong onboarding process and just the care and concern for the work. And so again, with it belonging to all of us, I also appreciate the work of Dr. Clark as well. We meet bi-weekly as well as a part of the process, just to hear more what's happening in the community, in addition to how we can work those things backwards. As a part of working with JDI, we're also in the process of working on a vision statement. We had a group of 8 folks that met last Friday just to discuss things. And so we came up with a good draft, but we're in the process of reflecting on that draft and what that will look like. Because, you know, when you come up with something that's that weighty and that meaty, you need to take time to think about what we're saying and do we have any changes of heart? So thinking about that work. Then also supporting Jason, and also the team in general with the public safety reform work. We actually had a meeting as project managers this morning, which was 7 a.m. Central Standard Time, I'd like to note. So we had that meeting, but then everybody's on the same page. And so in terms of just continuity and making sure that we put our best foot forward. And so lots of things will be coming your way in that area. Also on Saturday, we had training with the Racial Equity Institute groundwater training. We had lots of leaders from our community and lots of leaders from our area. I know that Jennifer Olin was there. I know Dr. Clark was there. I know that Amy was there. I know that Matt Van Houten was there, and just numerous others. If I didn't say your name, it's not because I don't care. It's because there were hundreds of folks there, and Tompkins County had a strong presence. And we'd like to thank Leslin for actually providing those spaces for us. And so that was an awesome training. But then from a strategic perspective, we'll be launching the anti-racist and equity agenda. And so that's all of that work combined together from a strategic space to ensure that we're moving our processes forward. And then in collaboration with that, we're working with the Government Alliance on Racial Equity as well. And so we're communicating with all of our partners throughout the country on the work that we're doing. And so making sure that we're not working in isolation, you know, listening. I said we have 2 ears and 1 mouth. And so doing twice as much listening as we are talking to ensure that what we do at Tompkins County is first rate, and that we also are listening to, even if they're not right in front of us, what are we hearing in terms of the pulse and temperature in our nation? And so that we can continue to lead and do that work with integrity and ensure that we are a place that folks can come to in terms of our work, in terms of diversity, equity, inclusion, and justice. So thank you for your time, and I will stand for any questions you may have.
Great. Thank you. It sounds like you are a mover and a shaker, which is what we need.
Well,
And I also appreciate the fact that you speak quickly. And I elect you as chair of HHS because we could probably get out of here in about 45 minutes. So, okay. Are there any questions for Deanna? Amanda.
Hi, Deanna. Thank you so much for jumping in and getting going. I don't really know a lot about what the JDI team is doing. Could you tell us a little more about that and like what their kind of goals are?
Sure. So it's something that, you know, JDI stands for Justice, Equity, Diversity, and Inclusion, and it's an employee-led initiative, and so it's going to work both horizontally and vertically. So we've met twice over the last month or so. They met about a month before I started, and we met last month as well. And then we are in a couple of weeks. We'll have our 3rd meeting. We're actually in the process of developing, so getting to know each other and just determining again, starting from the bottom up. Determining what our vision statement will be, determine what our purpose will be, what is the work that we decide to focus on. We have a group that is looking at the climate survey, you know, so specifically related to JDI, what does that look like? And so we met last week, and so we've distilled some of that data, but then also how do we turn that into actionable items? And so then also the JDI members are ambassadors for the organization. They serve as folks who are going to go out and be able to communicate some of these things. And then working across the crosswalk to the Workforce Diversity and Inclusion Committee, making sure that there's that cross communication there as well. Then also looking at professional development and some educational initiatives. So we're all, because it's so new, we're in the assessment phase. One of the things that I would applaud Amy for is she had 38 folks sign up with lots of energy, but we've also realized that there were challenges with technology. So not everybody was able to, access information in the same way. So what does that mean from an equity perspective? She went out and made sure that we had the staff had the resources that they needed so that we can all be at a base level in terms of that conversation. So the JDI group will serve as the core equity team. And so what that means is that we will have, for lack of a better word, I don't know if this sounds good or not, but tentacles throughout the organization to be able to do some of this work. And so we are, like I said, we're at the ground level phase. I just spoke with the Chief Equity and Diversity Officer from San Antonio last week. And I asked her, I said, what did you do for the first year? She said, we got to know each other. And so one of the things that we learned was that critical conversations are at the heart of the work. And so building that trust. And so I think, there's been tons of work that's happened. I know from the climate survey before, looking at, that resulted in diversity, inclusion, and infusion, that resulted in the performance evaluation group, and that resulted in the values group, that resulted in, in other areas. And so now we're in that phase, that second phase. And so JDI has been an offspring of that. And so now we are rising up as a group, but then also making sure that our leadership is informed, which would include you as a legislature, hearing about what does this mean to you? Because again, I'll say it again, diversity belongs to all of us. And so in that spirit, trying to come up with plans, and then also making sure that we're moving in a way that we are grounded in the work first and foremost, so that our roots are strong, so that we will be successful. And we don't, a lot of the work that I'm also doing is spending and talking to other chief equity and diversity officers across the country. I also spoke to someone from West Virginia last week. So learning those lessons in advance, and then also building that camaraderie across the country so that we here at Tompkins County is seen as an ally, but then making sure that our core equity team starts off and is as strong as possible. And so Amy, I know Amy's on her, so if you want to chime in or anything, I know that she's done a lot of this work and Jason's done a lot of this work. And so if I've missed anything, please don't hesitate to, jump in.
Great. Amy or Jason, do you have anything to add?
I do not. I think Deanna's encapsulated it all very quickly really synthesized it into what they've been up to.
Okay, great. Well, thank you for joining us. You are always welcome to come to HHS. Are there any other questions? Okay, I see no other hands. Thank you. We appreciate you here.
Thank you.
Okay, we have a few resolutions here today. Why don't we start out with the resolution contingent fund transfer for 2019, the CAL program payment for to Family and Children's Service of Ithaca, ID 9631. If I could have a moved by Dan, seconded by Deborah. And why don't we see if either Jason or Amy can explain this to us briefly.
Sure, I'll start and then Amy can finish. This is just a payment made or due for services in 2019. As you know, we have the community outreach worker. At the time, at the end of 2019, beginning of this year, we just didn't receive invoices for the services. So these are for services from 2019. And since the 2019 fiscal year is closed out, the only way to pay for this would be through a contingent transfer into our contract service line or program expense line to be able to pay for those services. Amy, is there anything else to it?
No, I think you hit it. That's the major thing. There was not a contract in place, so we couldn't pay for the service at that time. So that's where this comes from.
So essentially, Jason, what had happened was this funding was actually allocated, but since it wasn't spent, it went back into the contingent fund, and now we're pulling it back out?
Technically, no. At the year end, it either goes into fund balance or goes into rollover for those departments. In this case, because you're in a whole new fiscal year, we can't go back into prior fiscal years per se to reach those funds.
Okay. Are there any questions from committee members? I see none. Has this, have the kinks been worked out so that in future years we will receive an invoice and pay them on time?
They're in the process of being worked out now.
Okay.
We're
Okay.
still awaiting the 2020 contract so that we can invoice for it.
Okay. And then I just have one comment. Sorry, it's all me today, guys. No, I'm just trying.
All right.
I actually spent some time with Natalia and Tammy, and I just want you to say these two have such a grasp of what's going on in Ithaca. And I was just so impressed with their connections in our community, the respect and dignity that they treated everyone that they engaged with. And I mean, I was never apprehensive about this program, but I just didn't know what they did. And so it was good for me to go out there and to see what they did, and just to really see their kind hearts reach out to people that needed it the most. So thank you for offering these two people to our community. And I really, really like this program.
Thank you, Shauna.
Thank you, Shauna. And I really appreciate the fact that you took the time
Right.
to be with them and really see what a difference they make.
Absolutely. Okay, let's go ahead and vote on this resolution. If we could start with a roll call. Dan Klein,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Glenn Morey,
Yes.
and I am a yes as well. Thank you very much. That has passed unanimously. Thank you.
Thank you for having us here, and thank you for your work.
Thank you.
Yes, thank you.
And we'll see you probably this evening. Maybe, I don't know. Okay, next we have a resolution, acceptance of additional funds from the Kresge Foundation and budget adjustments, the Public Health Department, ID 9632. If I could have a mover, please. Moved by Amanda, seconded by Deborah. And let's see here. Frank, would you be able to talk to us a little bit about this?
Sure, thanks, Shauna. These funds come from the Kresge Foundation. If you'll recall, they're the group that funded the transformative work that Samantha Hilson and I have undertaken around the two departments over the last few years. And because we have a relationship with them, they were interested in funding local COVID gaps that might have been identified. And so thankfully, Reach Medical had received a grant from IURA for staff time to be able to sample our homeless populations within the encampment and other CBOs that support them. What we didn't have funding for was the testing itself. So Samantha Hilson submitted an application to the Kresge Foundation, and they've given us $40,000 to cover the testing side of things. So roughly between the two grants, we believe we can test upwards of 100 or 500 people or 500 tests. So that will give us some pretty significant capacity to reach those hard to reach populations.
That's really great. Thank you, Sam Hilson, for receiving grant funding, running the grants. It's always nice to have free money. Are there any questions on this? I see none. Let's do a roll call. Glenn Morey,
Yes.
Dan Klein,
Yes.
Amanda Champion,
Yes.
Deb Dawson,
Yes.
and I am a yes as well. That's unanimous. Thank you very much. Our next resolution, going right down the list here, is Department of Social Services. Resolution authorizing the Department of Social Services to accept and administer coronavirus aid, relief, and economic security from the CARES Act. Emergency Solutions Grant, ID 9633. Can I have a mover, please? Moved by Glenn, seconded by Amanda. And hello, Kit. Welcome to HHS.
Hi, thank you. So we are really excited about this, this money. This comes to us through OTDA. This is part of the CARES Act relief money, and it is really money that we have worked for the last couple of months, knowing this was going to be coming. Worked with the COC. We've had the health department and county administration talking with us about this, and really all of the members of the COC to kind of talk about how we would implement this. This is really going to provide a whole bunch of support around outreach, to folks that are homeless, some sanitation facilities, the bulk of the money is really about rapid rehousing and rental assistance. The goal here is to really assist those that have been impacted by COVID, to do some case management with folks and to look at how they can get support, with everything from job support to housing issues. And then to also help with evictions, some preventive legal services, as well as a little bit of money for quarantine and isolation for lodging and meals. So this is money that is coming to us now. We're just getting going with this, and we put this in place pretty quickly with the legislature's approval, and then would run into next year. So we're anticipating we'd spend about 20% of it this year, and then the balance into next year. So I think it's going to be a huge help to the community, particularly around that rental assistance and potential loss of housing after the eviction moratorium goes away.
That's great. Thank you, Kit. Are there any questions for Kit? Deborah?
Yes, thanks, Shauna. Thank you, Kit. Congratulations on this. A question arose about whether or not this money meets any needs that had already been budgeted for, or is this new money that meets new needs?
So this is pretty proscribed. The categories that we can use this in are pretty defined. And there was even a very proscribed process that OTDA required us to go through in terms of involving certain people and really developing how we could use the money. So I don't think there's a way right now. This is really all going to be additional services. I don't think there's a way that this is going to supplant or cover things that would already be in the budget, unfortunately.
You don't have to be regretful or apologetic. I just wanted the clarification. I know there's a lot of stuff that you've got to do that you didn't have to do before. So thank you.
I mean, she is bringing in $433,000.
Hey, I'm not arguing. I just wanted to know.
But I will say, if there was a way to help with the budget, I would certainly try to help with that. So.
Okay. Thanks, Kit.
Thank you.
Any other questions? See no other hands. Let's start with Dan Klein. Would you like to vote on this, Dan?
Yes.
Okay. Okay.
Sorry, I had to unpause.
Okay.
Unmuting.
Glenn Morey?
Yes.
Okay. Amanda?
Yes.
Deborah?
Yeah, I'll take $400,000.
And I will also take $433,000. That's unanimous. Thank you very much, Kit.
Thank you.
And you have two more resolutions, or you have one more resolution, actually. Department of Social Services budget adjustment to reflect solutions to end homelessness program, the STEP program grant increase, ID 9634.
Right. So this is another little gift coming to us from OTDA. And really what they did, again, they were kind of reallocating. There have been some changes across the state in terms of how funding has worked for STEP. I think it's a matter of reallocating things according to some counties rising to greater need than others. I think there's recognition that when it comes to housing and the expense that we face in this county, OTDA was recalculating things, and we happened to luck out and get a bit more than we typically do. So again, no super mystery here, but I'm glad that we've been allocated additional funds. And the STEP program has been incredibly successful, as you know. And I think, again, even with the money that we're getting through the CARES Act for eviction prevention and rapid rehousing, I think that STEP is going to be really instrumental in helping to keep people in housing and to kind of guide us at least until we're through this crisis. So I'm really pleased that that we're being bumped up from that 263,461 up to $300,000. So.
Deborah?
Yeah, thanks, Shauna. So the way you put that, it sounded like our homelessness problem may be worse than some of our neighbors' homelessness problems. Is that the case?
No, I don't think it's a homelessness specifically problem. I think what they have done is, in the midst of this crisis, it is not uncommon for OTDA to kind of look at what are the factors that make rehousing or affordability of housing a greater challenge in certain communities. And I think because of, it's kind of one of those things of like, because of our greater challenges, we kind of rose to the top. So I think it's that. We don't know exactly, but that's the indication we're getting from OTDA. They don't ever give us the full calculation or, explain exactly why, but that's the indication that we're getting from them. So I think it may just be that because we have high costs around housing in our county, and because there's not a tremendous abundance of available housing, I think that we were kind of selected to receive more.
Okay, thanks, Kit. Shauna, if you want a motion for it. I don't think we moved it.
Oh, okay. Would you like to move it, Deb?
Yeah.
Okay. Is there a seconder? Dan? We'll second. And I was wondering, have you noticed, Kit, that there have been any landlords reach out who might not be fully occupied that have had any openings for voucher housing?
We have not experienced that. I'm trying to think about, yeah, we have not experienced that. I think I'm trying to think about why that wouldn't be, Shauna, but we have not had people coming to the forefront around that. No.
I guess people, probably the students, have still a lease in effect.
Yeah.
And so the landlords, despite the students probably not being here, are still getting paid under that lease. So.
And I think with the eviction moratorium still holding, I think we really anticipate that we are going to see a tremendous need when that goes away if there's not some other measure implemented. But we haven't quite gotten there yet. So that may be, that may be part of what we're also kind of seeing right now.
Okay. Okay, are there any other questions for Kit? I see no other hands. Let's go ahead and vote. Glenn Morey?
Yes.
Dan Klein?
Yes.
Amanda Champion?
Yes.
Deb Dawson?
Yes.
And I am a yes as well. That's unanimous. Thank you very much, Kit. And would you like to do your presentation on the security assessment report?
Sure.
Okay.
So we use Skype for Business at DSS and not Zoom. So I'm going to try to share my screen, but I already called Katrina earlier today and said, if I can't stop sharing my screen at the end, you're going to have to cut me off. So hopefully this will all go off without a hitch. Okay, let's see. And let's see if I can actually do this like that. Can everybody see that?
Yeah.
Yes, ma'am.
Okay. So, so as you probably remember, in late 2019, we requested money to conduct a security assessment for the Human Services building. We had really seen an increase in some inflammatory situations in and around our lobby. And despite our efforts to have our security officers really de-escalate those, we continue to see problems arise. So to give you a little bit of foundation, we have 3 security officers that are employed at DSS. There's 1 officer that serves probation, primarily working in the day reporting program, which is a separate entrance in our building. So the 3 officers that work for DSS really oversee the plaza out front of the Human Services building, the lobby, the parking lots, and are generally responsible for kind of maintaining the security and safety of the environment around the building. So upon a recommendation from other counties who were familiar with business protection specialists, we contracted with them to provide an assessment of the building. So the primary reason that we thought a consultant could help was that we were really seeing an increase in the number of incidents that were in and around the lobby. And you can see here the increase, over 2018, 19, and 20. We have great security officers, but there's no really one person within the building that has specific expertise about kind of setting up our security protocols and our system that we use. And as we had seen that intensity and complexity of issues, what we were seeing is that clients were coming in and were oftentimes becoming very aggressive or very upset very quickly. Oftentimes, we were dealing with somebody who may be impaired with substances. We were becoming aware at times that there was a weapon, either that was possessed by the client or there was some other report that came in indicating there was a problem with weapons. So we really started seeing all of these factors: substances, domestic violence issues, a whole bunch of issues that concerned us, and we felt like we really needed to kind of take a look at how do we fully assess what the situation is. So why have we seen an increase in incidents? And we've all speculated about this, and we don't know specifically. What we do know is that there's definitely a change, has been a change over a number of years with the opioid crisis. Bail reform was instituted in April 2019, as well as mental health court was instituted in January 2019. Both of those things are good things. They're going in the right direction. They mean that people are not incarcerated as they wait for sentencing, or may not be incarcerated at all. Those are all the right things for us as a community, I think, to be doing. But the reality is that it also does mean that we have a situation oftentimes where we have people that are folks that previously would have been incarcerated for a couple of days. They had a cooling off period. And then, if there had been something that had happened when they were in our lobby, when they came back to us, there were other supports in place. They may have gone to treatment, or they may just have had, like I said, that cooling off period. Now what we really see is that people don't have that. There's an altercation or an issue in and around our community. And then people oftentimes speak with the police, and then they're back in our lobby in an hour. And sometimes they are angry because our security officers have recommended intervention by the police. So it's a complicated issue of trying to figure out what exactly is causing the increase in incidents. Some other issues, we are definitely seeing an increase in homelessness. And then we've also seen, obviously, an early release of incarcerated folks due to COVID-19, as well as an increase in unemployment, stress on everybody, and a need for increased services. So we contracted with business protection specialists in late 2019. We provided them with extensive documentation related to building, technology, security, incident reporting. They start their process by consulting remotely. So we spent a lot of time on the phone with them, gave them a lot of information about what we had been seeing and how our building and our security works. They came and did a physical plan assessment, and we really did. We then really consulted with everybody from department heads to security officers. Really, our senior staff team and county administration all discussed it. And then, of course, the COVID-19 impacted this process in February, and we were faced with many changes, and a lot of this process was put on hold as a result of those changes. So it took us a few months to kind of reconstitute the meetings to discuss the report. We got a draft midway through that, and finally received a final report at the end of June in 2020. So the good news about conducting an assessment of any program is that you kind of begin almost immediately to look for new approaches and solutions. So in the end of 2019, after we began discussing our security protocols with BPS, we made some changes to security in the lobby, which were pretty successful. We reconfigured the lobby to allow an officer to sit at the far end where they could see all the people in the lobby who are waiting. We worked with BPS to construct a podium-style check-in at the front desk. This created a situation where the clients were checking in with an officer before they actually went on to reception, because there was a lot of conflicts happening where people would just walk right up to reception, or we had people that were coming in, wouldn't check in at all, would just go sit down. They were oftentimes here to see friends. They wanted to use the restroom or the photocopier. And if people checked in at the podium and they did not have business in the building, they were directed elsewhere. So this began to kind of eliminate some of the conflicts that were arising between clients in the lobby, as well as the officers really got a chance to interact with people. And if they were impaired significantly, or there are those kinds of issues, it allowed us to kind of help people recognize that today wasn't a good day for them to come to an appointment. So some changes that we made mid-February or so, we received direction from OTDA, OCFS, and DOH, so Department of Health. The other two are the Office of Temporary and Disability Assistance and the Office of Children and Family Services. All of them are our oversight agencies. So we began to screen people for COVID-related concerns prior to their entering the lobby. OTDA provided a waiver which indicated that we should be determining eligibility without conducting a face-to-face interview. And OCFS required the screening over the phone before people could attend home visits or interacting on the child welfare side of things within the building. So shortly after all of this implementation, New York State accelerated implementation of a ITS project that we had known about but didn't expect it to come around so soon. It's called the Mobile Document Upload, which really allows clients to download an app on their phone and then to submit any necessary documents for eligibility determinations. This really helped. We had been allowing people to drop off documents rather than come all the way into the building or having to interact with their worker like they would typically do prior to this. But the mobile document upload has been a real gift to us and to the clients, who many of them, especially early on in the crisis before we were all wearing masks, were feeling very nervous about exposure.
Can I ask a question really quickly?
Sure.
Does that mobile document upload process completely replace a certification or recert interview, or is it just like for follow-up?
So it does not replace. Almost all of the recertifications right now for all of the eligibility programs are happening over the phone. So, but part of the process is that in order to do a recertification, just as with a new application, we have to require people to provide certain documentation.
Right.
So what it means is that rather than the person having to come in, make photocopies, drop off hard copies of things, they can actually take pictures of the documents with their phone and then upload them. Our worker can go into the website, grab the documents, and then process either the recertification or the full application without the client having, then they pick up the phone and call the client, but the client doesn't have to come to the building, which is a huge help. So
thank you.
Sure. So beginning in about April, it really became apparent that we were going to be coping with COVID-19 for a while. I think we all had that denial period where we kept thinking maybe this will go away. And we began to kind of, institute further protections for clients and staff. Perforated plexiglass was installed inside each of the reception windows because we were continuing to have people either get way too close or sometimes lean through the windows. A drop box was installed in the entryway of the HSB to allow for dropping paperwork off without an interface for both DSS as well as probation. A phone with a desk and a chair was provided outside the lobby doors to allow clients to call their workers without having to enter, and to allow people to work on paperwork at the desk or wait outside if it was necessary. We did have some scenarios where people would come in and through the screening would self-identify as not passing the screening, and so being able to work with people still outside and then having them call a worker was a huge help to them and to us. So most recently, we're instituting temperature checks as another level of support and protection. We're actually just getting that going this week. So some other changes that took place in the course of our restructuring, because there was no one allowed entry to the building without screening, the lobby doors, which had always allowed entry, independent entry and entry a half an hour before the building, the business hours fully opened, we stopped opening the doors early and started screening at 8:30 in the morning. We've been developing security written protocols, which is helpful for reference and documentation, as well as training new employees. In addition to those changes we've made as a result of the BPS report, we've had extensive discussion with multiple groups and have consulted with facilities to ensure that our technology is secure, that we're using the best approaches, and to determine if the recommendations are applicable to our situation in the lobby. So the following are a list of recommendations that we either have or we're taking steps to implement currently. Security officers have been fitted and we are ordering Kevlar vests for the protections of the officers. A laminate film that prevents glass shattering. It's something that that's on order. We've worked with facilities around that. That will be applied to the front doors. And that prevents, if somebody throws something through the glass or were to even bang the doors hard enough that the glass would break, what it does is prevent dangerous shards of glass from going everywhere. It kind of works like safety glass in a car. We have a plan in place currently to track disruptive behaviors and conduct administrative reviews of incident reports on a monthly basis. BPS really helped us kind of beef up what we were doing there. And we also engage in case planning as incidents occur to ensure that workers who have a relationship with clients are a part of the planning process. Sometimes, if somebody's coming in and repeatedly getting into conflicts or having difficulty involving that person at DSS that they have a relationship with can be really helpful. We've engaged in conversations with our neighbors around the HSB to kind of plan and support a unified approach where possible and kind of plan for solutions. We are not the only folks that have seen an increase in activity and incidents. Staff and cars have also experienced that. So we've been able to kind of communicate with them some. We've added an administrative staff person to the security office to really handle all deliveries and to handle the mail and other administrative functions so that we're not pulling our security staff away from their posts at security to be able to handle administrative matters. That had actually happened a while ago, but was part of the conversation as we talked to BPS. So we have some report recommendations that are currently on hold. all of the use of force recommendations that were included in the report are on hold. And if we do ever implement them, I think will require further consultation, either with BPS and or others. I think with currently the screening that's taking place before somebody enters the building, there's no real need to implement these. And currently, if we were to implement these, there would need to be really significant development of protocols, training of officers, and an agreement that we were really ready to move forward in that direction. There was significant discussion about this part of the report by many people that we have kind of had as our stakeholders. BPS has really said, you know, these tools, the tools that are listed in the report are things that are used with almost every security team in environments like hospitals and clinics. But the reality is that I think we know that they also can potentially pose a danger and a liability, and we would want to carefully consult with others before we moved in that direction. There's a few other recommendations that are currently being discussed, but we've not rushed to implement them. There's some things like BPS has recommended that we secure our panic buttons in the interview rooms. Currently, we're not doing face-to-face interviews in the interview room, so we really at this point have put that discussion on hold. But as we, you know, if we hear that the face-to-face waivers not going to be continuing to be in force, then we will have conversation and begin to kind of think that through. There's kind of pros and cons to a number of different issues like that. Staff tend to like to be able to put the panic button where they want to put it, depending on the configuration of the room. On the other hand, BPS makes some good points about if it's always in the same place, then people know where it is. So those are things I think that we will need to discuss more fully and come up with what works best. So our current focus really is to continue to offer training to our security officers, specifically in the area of de-escalation. We really want to beef up some mental health awareness and some addiction training. The report also indicates that we should add another security officer to our team. We've taken some time to examine this, but it really does seem necessary to probably provide the safety that we need. I think that this will be discussed with county administration, and currently there's, you know, as everybody knows, there's not a worse time to ask for additional staff. So I think we've got to kind of look at what can be done and when. The primary focus that we have currently is to really prepare for the cold weather months that are coming up. We're really trying to look at how do we continue to screen people, but not put an undue burden on clients. We're trying to look at things like how do we create a windbreak? How do we deal with people that, you know, are elderly or disabled that could have to wait in the cold, and really minimize that, but still maintain safety for everybody in the lobby and externally. And we are recognizing that our population in the lobby is going to increase as that cold weather happens, and as our homeless population probably continues to rise. So we're looking again at, you know, how do we create barriers inside our lobby that will allow us to make sure that people are social distancing, that we can have family units that come in together, be able to stay within a certain area, but separate from others. So there's a number of logistical issues that we are trying to think through. It's it all sounds fairly simple to be able to come up with barriers, but when you actually start to really work on those, it's a fairly complicated thing. And although the population in our lobby had declined during kind of the summer months with COVID, with the courts reopening, probation is really back to previous, you know, prior to COVID visits. Homeless numbers are on the rise. And then with the eviction moratorium potentially going away, we anticipate that we will see larger numbers in our lobby and visiting in person. So that is kind of where we are at this point. are there questions? Are there things that I can provide answers to about what our process has been?
I was wondering, as far as the vests that had to be ordered and any expenses, were you able to, did you have the funding in rollover funds, or was there a lot somewhere that you had the funding?
So we are going to be able to pay. We are going to be able to pay for the vests out of this budget cycle. They are expensive. I believe there's something like $1,200 a piece. So they're pretty costly. We are very fortunate that I believe the line that we are probably going to take them from is it's a supply line, like a furnishings line, or a supply line like that. And so we did not, especially because of the health crisis this year, we did not do things like buy new chairs when we usually would, and some of those kinds of things that typically would have happened if everybody was in the office and everything was going full steam. So I do believe that we will be able to fit that into this year's budget.
Great, thank you. I see a hand up from Ann Corman. Annie, do you have a question?
Thank you. Had to find my mute button.
Okay.
Sorry about that. Running in between a couple things. So I didn't catch the very first maybe 15, 16 minutes of the meeting, but hearing about the grants, I'm just wondering if the grants that you were able to get, can they help pay for any of this, or are they earmarked for other things? Just wondering where all that money's going to go.
Yeah, so unfortunately, the answer is no. The grants that I talked about, they are really proscribed in terms of how we can spend that money, and the great majority of that is all really reserved for clients and for rapid rehousing. There is a case management position to the ESG money, but it's not, it's not something that would involve security at all. So no, unfortunately, we don't have a way to do that. I'm sorry.
Okay, thanks for letting me know.
Sure. Thanks, Annie. Deborah Dawson.
Yes, thanks. Kit, I want to thank you for being so considerate of our fiscal predicament and paying for those Kevlar vests out of another line. I appreciate that. Thank you.
Sure, absolutely. We all know the pain, unfortunately, this year.
Okay, I see no other hands. Thank you very much, Kit. Would you like to give your Department of Social Service update? Are there any other things you would like to share with us?
Sure. Let me see if have I stopped sharing my screen at this point, or can you still see that?
We can still see it.
Okay. So I'm gonna let Katrina or Kathy cut me off. They did it. That's great. Like I said, I'm not so familiar with Zoom and my actually having the wheel when it comes to that. So yes, we are really a lot of what I've just talked about today are kind of what's in progress right now. We are busy trying to put things in place so that we can get going with the ESG money. We are seeing an increase in our homeless population. I would say that the challenges abound these days. We're running about 10 to 14 people a day that have either sick kids, and so they're having to quarantine with them, or they're having to work remotely. We're challenged by some of those things, and of course, with a positive case last week, everybody's been a little bit on edge. But I think that as has been said before, we had a very conscientious staff person who took all the right actions and did the right things. So we've been very fortunate with that. So we are just trying to kind of keep everything going. We're working on getting transfers from other departments up and running. they are starting this week. So we are pleased to have them and pleased to be getting our positions filled. We've been waiting for a while, and so it will be great not to be covering, for people to be covering multiple tasks and duties. So that's probably the full department update. We're getting ready for winter and trying to anticipate what will come.
Great, thank you, Kit. Are there any questions for Kit? Okay, I don't see any. Thank you very much. And thank you for the presentation.
Absolutely, thank you.
Great. Let's see here. Frank, would you like to give us an update for public health and mental health?
I'm trying. Sorry, Shauna. Yes, thank you. Let me start with mental health. Things are continuing along. We're actually beginning to do a bit more in-person work at the health department. Our PROS program has expanded. They were kind of the first ones to bring clients back into the building. And so they did that successfully and have now expanded and are offering multiple classes throughout the day and throughout the week. So that's good news. Particularly for those folks that were used to kind of that group setting and learning together. We've also been focusing on children. One of the hardest groups for us to reach through telemedicine were children, particularly young children. We are back in some of the school districts. To varying degrees. Some were in there in person, some we've set it up where we're providing telemedicine while the kids are at school, and others were still, working the details out. But we have repurposed some space on the first floor of the building to be able to see children face to face. So if you're familiar with the building at all, we have several large rooms on the first floor that PROS usually uses. And we've been kind of sharing that space a bit more to allow us the ability to see those children. And of course, we've been prioritizing the children as we bring people back to the building because they have been the hardest for us to reach with telemedicine. We've also expanded some of our forensics programming to do a bit more in person as well. So beginning to start to see that happen. We are looking at spaces up in the building on the higher floors to try to see if there's other locations like our group rooms that could be set up to do face-to-face, allowing the 6 foot of separation. The challenge is, you really have to be behind a closed door for privacy. Generally, our sessions are 45 minutes. So it's a challenge to find any space that's really usable to meet our COVID guidelines. The access to service, we are still seeing about 60% of pre-COVID intakes at the clinic. So those continue to be down. However, we are providing about the same level of service we were pre-COVID. So the clinicians have been able to engage through telemedicine with their clients. And we've said this before, for some clients, this has been a godsend. It's taken away all of the barriers that there were for them to get connected to their therapist. For others, we know this is not working. And, so that's why we are continuing to look at ways to try to do face-to-face if at all possible. What we do know, both from our own experience and from talking with our partners in the community, is crisis needs are up. So the Suicide Prevention and Crisis Line has seen a significant increase in calls and that they are working through. I think both family and children's as well as our clinicians would tell you that they are dealing with clients that have more significant needs. So we have a lot of work to do to get the word out, one, that we're available for service and that folks should come seek our help before it gets to the crisis level. And I think there are still a lot of people out there that could use our support that have never accessed the mental health system before and for a myriad of reasons are not able to or have not yet reached out. So we're going to continue to do outreach and try to get the word out about that in the coming weeks to support folks in the community. So I think that's what's been going on at mental health. Public health, it's been mostly COVID for the last few weeks. Cases have ticked up, and so it's kept us busy. We've had to pull in the children's special care needs nurses a bit more. I don't think it's as bad as it was at its peak, but so they are still able to do their early intervention work, but they are definitely being stretched between both right now as the cases have gone up. We've been really fortunate that the other county departments have really stepped in. I think we have almost 30 people that are being trained to help make follow-up phone calls. We're now moving into contact tracing with some of them that have shown interest and skill. And we have a couple that are close that we think might even be capable of doing case investigations if we needed them. So they've been really, really helpful, and we really appreciate all that support. It's really helped the nurses. We wouldn't have been able to do it without them. So that's been super helpful. Environmental health has been busy with enforcement and just trying to help continue to educate on the guidance for operating safely in the community. Thankfully, we haven't had to pull them into the case investigation contact tracing yet because of all the help we've gotten from the other county departments. So that's been really good for them to be able to do that. We are still very limited in the services that we're providing beyond COVID. Early intervention is probably the main one that is fully operational because it has to be for those kids. Environmental health, I would imagine, is probably 80 to 85% COVID in the work that they're doing, and CHS is 100%. Right? I mean, that's really all they're doing unless another communicable disease issue comes up. But that's where the departments are right now. As far as COVID, and you'll hear more about this tomorrow, cases are up. We've had, I think, 103 cases since October 1st. We're still not to the levels of the folks around us. So it's that's the good news. But we are definitely seeing the impact of what's happening around us. We're seeing a lot of instances of cases that are not ours because they live in another county, but perhaps they work here. And so we have a lot of contacts. Our contact transfer portal from other counties is very, very active. And then we're seeing folks that are ours that live here that have traveled, either they work or they were, in a surrounding county. And then we have community spread here, right? We have folks that we have not been able to identify their exposure point, and they haven't really talked about being outside of the county recently. So it is a little bit of everything. And we're continuing to work through that. I mean, the message is still the same, right? We need to wear a mask. We need to stay 6 feet apart. We need to avoid large gatherings. And so that hasn't changed. Understand that there's fatigue. COVID fatigue is a new word now, right? Compliance fatigue. We're hearing that, and it's real, and we certainly understand it. But now is not the time to let our guard down, particularly as the fall is approaching with winter weather and what is our traditional flu season. I would encourage everyone to get their flu shot if they haven't already. That's one of the best tools that will help us get through this fall as we're awaiting a vaccine for COVID. I am knee deep in this all day, every day, so I never know how much is too much. So I'll probably just stop there and answer whatever questions that you guys might have.
Frank, can you tell us, whenever there is a classroom and a student is positive, are all kids asked to be tested, and then are they quarantined for the 14 days?
So yeah, I think we've come to that now that we've had several experiences, that just because of what we're seeing with the cases increasing and out of an abundance of caution, if students are in a classroom, we are considering them a close contact and quarantining them. It is not a requirement that you get tested as part of quarantine, right? Because quarantine is about the incubation period. We certainly, recommend that if folks are going to get tested, they should wait to day 5 or 7 of their quarantine, because that's kind of the average incubation period. And certainly, if they wanted to get tested before they left quarantine, that would certainly be something worth considering as well. But there's no requirement to get tested if you are in quarantine.
So there's no way to make that, I just want to clarify some things that I've heard in the community. There's no way to shorten that quarantine period by getting 2 negative tests.
No, the quarantine period has nothing to do with testing. It's the incubation of the disease. The test tells you in that moment that you were tested whether you were positive or not. We know that the disease takes 2 to 14 days to incubate. So you could test negative on day 13 and become positive on day 14. So testing does not shorten the quarantine period.
Okay. Amanda.
Yeah, thank you. Thanks, Frank, for all the information. I was just wondering a little bit more about the staff people who are doing the contact, or they're not doing, wait, what are they doing? and they're doing follow-up conversations and checking in on people. How are you sorry, I'm not being very articulate. How are you finding these people? I mean, are they volunteering? How do you know that they're qualified enough to do this work? I guess I'm just wondering how you're identifying.
Sure. You're referring to the other county employees?
Yeah.
Yeah. So they're all volunteers. Jay Franklin and Amy through the EOC reached out to department heads to identify people that would be interested in volunteering. So it's all been volunteer so far. They go through significant training with our nurses before they do anything. Typically, they're doing the Johns Hopkins contact tracing training. There is some ComCare training, which is the state system that we use. And then they do some just-in-time training with the nurses on their first day. We actually have now identified let's call it her a volunteer rock star from the assessment department, Heather Richway, and so she's really been really great for us. And so now she is we've done train the trainer for her, so she's now training the new volunteers as they come on. So it's taken that burden off of the nurses as well too. Obviously, we support her and follow behind to make sure things are okay. But we have a pretty good process for that. And so generally the folks that are making calls, the first thing that we've asked them to do is call positive cases, right? Because we have to do a daily check, and we do those all by phone. They don't do anyone that is symptomatic. The nurses keep those because we obviously, if someone is symptomatic, we want to have a healthcare professional talking to them. So we've put protocols in place not only to train them, but to make sure that the cases that do need a nurse still have a nurse contacting them.
Great. Thank you for further information.
Are there any other questions for Frank? Dan?
Frank, can you give us an update on hiring nurses to help us out, help our staff out?
Yep. On Friday, we signed the contract with the traveling nurse organization. So Lisa Holmes is now in the process of getting 3 nurses from them identified, and we're hoping to hear in the next day or so when we can expect them to be on site. So we're getting closer. My hope would be within the next 2 weeks that we'd have 3 more nurses working Thursday through Monday.
Great. I just want to mention I was talking to a nurse, not somebody in the health department, and talking about our situation. She, confirmed what you're saying. It's really hard to find nurses. Everyone who's a nurse that wants a job can get one. But she did mention something. It's just one person's idea. I just thought I'd mention it, that her experience or her observation is that there were a lot of healthcare professionals that retired as this happened, the older, especially older ones, they didn't want to be in direct contact. And I just thought that might be an interesting pool if we can find them.
Yeah.
That because this job doesn't require in-person contact. So it's just a thought, do whatever you want with it or nothing.
Yeah, we did try that. Cayuga Medical Center was our first go-to. In fact, we are contracting with them for one nurse that's working with us right now. They did reach out to all their recent retirees to see if there was interest, and it didn't result in anything. But we have used retirees as volunteers, particularly earlier on in the pandemic. We had several retirees of the health department and other places that had come back. So yeah, we do beat the bushes everywhere we can to try to find that help. But thanks Dan, we'll keep looking.
Thank you.
Any other questions for Frank? I see no other hands. Thank you, Frank.
Sure.
Thank you for your hard work, and thank you and your staff. Okay, let's move on to Bridget, who is here from Youth Services. Welcome to the HHS, Bridget. Long time no see.
Hi, I know. How are you? It's nice to see you. Just a couple quick highlights from the Youth Services Department. I, along with a member of both DSS and our probation department, will be representing Tompkins County at a year-long results-based leadership training hosted by the Central New York Regional Youth Justice Team. We'll be working together to focus on a particular data-related issue in the realm of juvenile justice. We just had our first session last week, so I look forward to kind of bringing forward updates on the work that we're able to bring back. Our department continues to plan and promote our virtual trainings. We've shifted, as you know, the kind of in-person trainings that we were providing to youth development professionals and caregivers in the community to the virtual space. I'm particularly excited about a 2-day workshop that we have next week on the 28th and 29th. It's going to look at tech safety and how we connect with youth. We know that's what most of our caregivers are kind of dealing with right now, as well as our teachers and other youth development professionals. And this is in partnership with the Advocacy Center, using some of that safe harbor funding that we get to reduce the risk of child exploitation online. So that series will, like I said, be next Wednesday and Thursday. And we'll have a series of workshops that anyone can attend that will also be recorded and shared. So we're looking to promote that. And lastly, we are working with our runaway and homeless youth partners. You may or may not be aware, but Family and Children's Services Open Doors program has decided to end at the end of this year. So we're working closely with them, as well as our other partner, the Learning Web, to make sure that we're addressing any sort of needs or gaps that might arise starting in the new year. So we are busy with those things. And that's all I have.
Great. Thank you, Bridget.
You're welcome.
Have a nice day. Let's move on to the Office of Human Rights. Reverend Ken Clark. Welcome to HHS. Hello, Ken.
Hi, how's everyone?
All right.
I'm good. I have a few updates. Last month on September 29th, we launched our monthly virtual brown bag lunch series, which will run through the end of this year, which we co-sponsored with Public Health, Mental Health, and the Chief Equity and Diversity Officer. Our first program, which was called Intersecting Pandemics, COVID-19, Racism, Addiction, and Poverty, drew an audience of 200 for the live event. And overall on that day, 300 visits to the YouTube page, county's YouTube page on which it was broadcast. Our next event will focus on COVID-19, compassionate mental health and social services, and that'll be held on October the 29th at noon. Kit will be one of the, Kit and Dina Bodnar will be among the panelists. For our September event, Frank Krupa was one of our panelists and did a great job for us, and we're looking forward to our colleagues joining us, as well as several other professionals in mental health and social services fields. So we'll be getting notices out this week about that event, and hope you will be able to join us. We also co-hosted with CNY Fair Housing 2 events for landlords, housing providers, and tenants to provide them updates on fair housing and tenants' rights. And we also held a similar event for county staff on October the 8th. The 2 events for landlords, housing providers, and tenants were held on October the 1st. Also, our Human Rights Commission will soon be releasing publicly a statement on racist violence and injustice and a plan for action. They've been working on this statement for quite some time, and it is something that they began to work on in response to the murder of George Floyd, and have been working on this, and now are ready to release this to the public. And we will be working with Dominic and others to send these documents out to a variety of venues. And last thing I'll mention is that Tompkins Weekly published an article about 2 weeks ago about Executive Exchange of Tompkins County, also known as XX. It's a group of 100 nonprofit directors, of which I am a part, and as are several other county colleagues. In the article in Tompkins Weekly covered a statement that was released about a commitment to equity and anti-racism work. I served as the editor of that statement and worked in collaboration with several XX directors in terms of the editing process, but that's now out and available to the public, and it is fundamentally a commitment on the part of nonprofit leaders to engage in this work, to engage their boards and other entities of accountability to which they report around these types of issues, and to do that with an eye toward serving the public for a greater good. So those are our updates from OHR.
Great. Thank you, Reverend Ken. Are there any questions? Do not see any hands. Thank you very much. Lisa Monroe from Office for the Aging. Welcome to HHS. Uh-oh, we can't hear you. Sorry. Uh-oh. You know, it's interesting because I see you the muting going off. Oh, maybe Lisa's going to rejoin us. Okay, why don't we move on to, oh, hey, Lisa, welcome back. I think she's frozen. Okay, why don't we move on to J.R. Claiborne, and we'll see if Lisa can get a better connection. Hello, J.R. from Veteran Services.
Hello, can everybody hear me?
Yeah.
Yes, sir.
All right. Oh, great. Now my phone's ringing. Sorry.
It probably hasn't rung the whole meeting.
It has not until just now, but okay. Well, hello, everybody. Thank you. Yeah, happy Monday. It's kind of dreary outside, wet, a regular Monday. I think this is one where everybody should just get to go home, start the week over tomorrow.
Sounds good.
But as far as my department's concerned, got a couple of things here to share with you. One, as always, our doors are still closed, but I do remain open for business. So where there's calls, we're starting to see occasional walk-ins, but for the most part, everybody's sticking to phones or making appointments. Last week, actually, this past Thursday, we had our last coffee house event. It's the event I co-sponsor with Team RWB up at Cornell. And we actually did this one at the Groton American Legion. It's the Carrington Fuller Post 800. We did it there. We had about a dozen people in attendance. And I really wanted to take a moment just to applaud the folks at the American Legion. Commander Frank Hine is the leader there, and he has everybody there on board with taking COVID prevention serious. I mean, they make sure that they have everything measured out. Like, we tried to move a couple of tables and they're like, wait a minute, that's not 6 feet. So they were on top of everything. I always bring an attestation form. We make sure that folks sign that when they come in. So we do have that, and I keep those. And everybody has masks. They had signs up all over the place. They had the hand sanitizer all over. And plus they provided they had their kitchen open for us to order lunch. So it was a really good time. We had about a dozen people come out, mix of folks, and they all just got to have just some time to get out of the house, get around some other people. And one of the guys actually had made a comment about just being thankful that we were able to have something that was in a safe setting that allowed some of the veterans to just be able to get out, because they're finding that being able to break that sense of isolation has been very important. The budget, of course, since last time I saw you, I was presenting my budget and also took care of the rollover submission form. So I'm finding it very interesting sitting on this side of the desk, all these things that go into creating a budget from the other side here. So that's been a learning experience for me, but I made it through painlessly. I believe I got an attaboy from Kevin, so I think I'm doing all right there. Earlier this month, I was honored to be part of the Veterans Seminar. I was one of the speakers at a class that's conducted by Cornell's manager of their Student Veteran Advocate Program. And she had a class with about a dozen veterans. A lot of them are brand new out of the service, different branches. And basically I let them know about what my office does, where it's located, and how it can be of service for them. And then the last thing I have, well, at least for this part of my updates, is part of Deanna's report about the visioning team for Team JDI. I got to be part of that meeting. So we just did that last Friday, and that was very energetic group, and a good exercise in trying to help come together and figure out a direction that we can use to help guide the Team JDI's work. I do want to share that I'm still continuing to support our warrior writers. We are still meeting virtually, and our next session will be this Thursday evening, the 22nd. I'm also still sending out the information for my listserv, Tompkins County Veterans Listserv, which has just over 120 people right now on it. And so that's been a good way to get information shared that's related to the veterans news. And that list consists of veterans and their families, some of their family members, as well as veteran service providers. And then lastly, I just want to remind you, in case you're interested, that we are still taking signups for the next mental health first aid for veterans and their caregivers. This training will be virtual. We are co-sponsoring that one. And so contact me if you're interested in signing up for that. Or I can always just send you the flyer and you can do that.
Great, JR. If you would like to send us the flyer or send it to Kathy Covert and she can send it to all of the legislators, it'd be nice for us to get it out in our networks.
I can do that.
Great, thank you. Are there any questions for JR? I don't see any hands. Thank you, JR.
Thank you. Take care, everybody.
You too. And Lisa Monroe from Office for the Aging.
Can you hear me?
Yes.
Wow.
Welcome.
Weirdest thing I've ever had happen. That was so strange. I was plugged into my docking station and it had a speaker problem. Unplugged it and just everything shut down. I haven't seen that. So yeah, well, thank you. Just a couple announcements. Medicare open enrollment started on the 15th. It runs through December 7th. And you can call our office to schedule appointments we have 2 full-time health insurance counselors who are here every day to answer calls and do appointments virtually. And if we get too busy, we also have Lifelong. We contract with them and they have volunteer counselors that can schedule appointments. This year we're doing our public hearing on Tuesday, October 27th. That'll be at 2:30 and this will be virtually held. It's going to be on the county's YouTube page. It's really just an opportunity for the public to provide input, feedback prior, during, through the chat feature and post hearing. We have a survey associated with that to get some more feedback from people, and we have paper copies available as well. And also normally something we would do in May would have our annual luncheon with our annual report that would have gone out at the same time. That is out for 2019. It's on our website if anybody's interested in looking at that. That's really all I have.
Great. Thank you very much, Lisa.
You're welcome.
And last but not least, I see Kathy Schlatter. Hello, Kathy. Welcome to HHS.
Hi, nice to be here.
Yeah.
I also don't have a lot to report on. We also will be happy to see the budget, as everyone here will be. Agencies are pretty much doing business as usual. Nobody's been able to change a lot of the way they've been providing services, including us, for the last 7 months, I think we're at now. Some people have opened slightly, have a few more people in the office, but very few people are, as I say, open, unlock their doors. The one big thing I know that we're doing a lot of talking about right now is around daycare. There are a lot of daycare providers who are having a really hard time. They're struggling. I talk a lot with Sue Del Hall, and she is very concerned about the ability of daycare providers to continue providing services. So we are trying to gather to both talk about, how to get that word out to people, but also, doing some brainstorming around how we can help daycare providers. And it's not, the news of an uptick is not working in their favor. And so, so that's kind of where we're at right now.
Great. Well, thank you, Kathy, for coming to HHS today. Are there any other comments or questions from committee members? I see none. We do have some minutes that need to be approved. If I could have a mover for September 21st, 2020 minutes. Moved by Deborah, seconded by Amanda. And let's do a roll call. Amanda? Yeah?
Yes.
I think, Glenn, are you all right with the minutes?
Yes.
Okay. Deborah?
Yes.
Dan Klein?
Yes.
And I am a yes as well. So those pass unanimously. And let's go ahead and adjourn. And I'll see everyone in about an hour, I guess. 2 hours.
2 hours.
Thanks, Shauna.
Bye, guys. Thank you.
Bye.
Thanks,
Have a good day.
Kathy.
Bye.